There's new pressure on President Trump to direct federal funds away from clinics that do abortions in favor of qualified health clinics that provide medical care but do not perform abortions. Let's discuss tonight with our panel. Penny Young Nance, the CEO and president of Concerned Women for America, and Dr. Ronnie Floyd, the president of the National Day of Prayer. We will talk about that. It's coming up tomorrow as well. Welcome to you both. Great to have you here.
It's good to be here.
Okay, so this issue that Garrett touched on there, that there are a lot in the base who are very unhappy that not only did Republicans in great numbers vote to pass this bill that still contains funding for Planned Parenthood, the president signed it. In fact, this came up in the West Virginia Senate debate last night, where the attorney general there is running against a current member of Congress, Representative Jenkins, who voted for it. Here's what the interchange was.
Planned Parenthood spending just a couple weeks ago. Evan, you should be ashamed of yourself for that outrageous vote, killing the unborn.
Penny, I know that you're hearing an earful from the base who's not happy about this.
Yes, actually, when that vote happened, my phone was burning up even on vacation. You know, this is the most pro-life president in recent history. Not just that, this is the most pro-life White House staff in recent history. And he's done a lot towards that issue, but we still got further to go on this. At this point, there's still within the regulation, Clinton-era regs, that says that in order to participate in Title X, you need to be able to refer for abortion.
And that's taxpayer money that goes to these clinics.
$286 million a year of taxpayer money that goes to 4,000 health clinics, Title X clinics. Only 500 of those, by the way, are Planned Parenthood clinics. And what we've simply said is, let's go back to the Reagan-era regulation that, by the way, was affirmed by the Supreme Court in Russ v. Sullivan. It is legal, that says we're not going to entangle taxpayer money with abortion. If you're going to accept this money, you can't be co-located in an abortion clinic. You can't be in an abortion clinic and accept the money, and you can't refer and counsel for abortion.
And here's what Planned Parenthood says about this proposal. They say it would have devastating consequences and essentially dismantle the nation's program for affordable birth control and reproductive health care, which 4 million people rely on. The policy is dangerous. It would keep women from having information and from getting the best health care possible. Penny?
Remember, this is the group that held up Zika funding for care for people in Puerto Rico because they wanted a piece of the action. This is the abortion mafia. They want all the money for themselves. Their abortion business model has grown while abortion's gone down in the rest of the country. This is simply about more for them. This regulation and the change in the regulation we're proposing actually opens the door for more people to compete, faith-based groups to compete, and for it actually to care for poor women. Plus, we said let's shift funding to the 13,000 community health centers that actually do care for poor women but don't do abortion.
All right, Dr. Floyd, I know this is not why you're here in town, but you have spoken out on this topic, and you say that America needs to have some very honest conversations about this.
Yeah, we really do. I mean, it's obviously one of the major issues in the hearts of all evangelicals and conservatives, and we need to work through this issue. In fact, tomorrow, as thousands and thousands of gatherings will happen across America on the National Day of Prayer, many of those gatherings will really focus in on matters of concern about the culture and about things that are not contributing to the sanctity and the dignity of human life, and to pray for our country in regard to that.
What do you say to those who would say, though, this is not a conversation that we should even be having? This administration should not be imposing what they view as religious beliefs when it comes to federal money and these conversations about access to abortion. And, you know, just thinking of the National Day of Prayer tomorrow, Americans United for Separation of Church and State say it's a vehicle for spreading religious misinformation and fundamentalist Christian doctrine. Your response?
Wow. Well, first of all, the National Day of Prayer, mobilizes unified public prayer for America. And we can call out to God and talk to God about America. And one thing that we have been really, just really convicted of is that prayer crosses all the aisles. I mean, prayer is not about politics. Prayer is about something we can do together, because we can go to God anywhere, anytime, anywhere about anything. And tomorrow is a day when millions of Americans are going to go to God about our country and pray for our country and its future.
Yeah, my understanding about this day is it is spread across any denomination, any belief system,
Absolutely.
And it's meant to unify people and not divide them. So
Absolutely.
We will watch for those events tomorrow. Thank you for stopping in, Dr.
Thank
Floyd,
you.
while you're here, and Penny for this hot topic as well. Good to see you both.